महावीर वंदे महायशं महाभागं महावीरं महामुनि अमर नरराय मह्यं चरमतीर्थयरं हिमसतीर्थं 24 की आनंद 24 सर्वारिष्ट प्रणाशाय सर्वाभिष्टार्थदायिने सर्वलब्धे निधानं श्री गौतम स्वामिने श्री सुधर्म स्वामिने नमः। अज्ञानतिमिरान्धानां ज्ञानं जनशलाकया नेत्रमुन्मीलितं येन तस्मै श्री गुरवे। धर्म लाभ बहुत बहुत आशीर्वाद सब वे श्रदमकार सिंह भोर सिंह सातपुर सिंह सड़गे पुलमुठी सिंह बचका वे श्रे चौबीर प्यारम तेन प्यारम असुरमण सागरम तनम सुवसदनम आयम बिलम बचका विगम सामुलेवारम गयो तसुतित प्रतिवारम सुवसदनम एक आश्रम पे आश्रम बचकाई ते बियम प्यारम संगम सागरम नाव पंचम गुरु चंद्रवारे तम सुवसदनम पानस लेवन वाले बहुलेन वासी तेवासी तेवा वो सिरे धर्मलाभ भाग्यशाली। आज 6 अक्टूबर को शुक्रवार के दिन हमारी पहली क्लास इस समय आनंदगंज 24 की, इसके पश्चात वाली दूसरी क्लास जीव विज्ञान की चल रही। देखिए, आनंदगंज जी भी एक अवधूत योगी, पक्कड़ बाबा जिसको बोलते हैं, लेकिन एक विशेषता इतनी बड़ी थी कि इतने विद्वान थे, इतने गहन विद्वान और भेद ज्ञान, अध्यात्म ज्ञान, द्रव्य ज्ञान, पदार्थ ज्ञान के इतने बड़े ज्ञाता थे। और ऐसे महापुरुष अपने जीवन काल के अंदर जब अपने अभ्यास के इस निचोड़ को अनुभूति में ला करके स्तवनों के अंदर ढूंढ रहे हैं, इतनी बड़ी बात है, बहुत मुश्किल है। और उसे अपनी विद्वत्ता के आधार पर छंद शास्त्र के अंदर ला उन्होंने जो भी अपने चिंतन मनन की धारा को इतने ज्ञान से अनुभूति के स्तर पर ला करके अब कविता, काव्य, छंद शास्त्र के अनुसार में ढालते हुए इन सारे तत्वों को उसमें भरना बहुत बहुत मुश्किल होता है, बहुत कठिन होता है। और लोग, सर्वसामान्य लोग जो अपनी तरफ से जो जिस तरह से स्तवनों की रचना, काव्य रचना, कविता रचना आदि करते हैं, लेकिन अधिकांश स्तवनों के अंदर देखेंगे अपना ही मोहनीय कर्म, मोह कर्म की इच्छाएं और सुख दुख की बातें जोड़ करके भर देते हैं। सर्वसामान्य लोगों को अच्छा लगता है, लेकिन ये महापुरुष आनंदगंज जी भी है, देवचंद्र जी महात्मा भी हुए, इन दोनों ने इतना ऊंचा भेद ज्ञान, इतना अच्छा तत्व ज्ञान, इतना अच्छा आध्यात्मिक ज्ञान, हाँ जी कुर्सी, इतना अच्छा आध्यात्मिक तत्व ज्ञान उसके अंदर भर कर दिया है। ऐसी विशेषता देखो, अभी डॉक्टर साहब आए हैं। आपको सबको भी थोड़ा सा इधर को। हाँ जी, ये सुनील जी आचलिया जी कल ही यहाँ पर आए हैं और विशेषकर से अभी क्लास में भी आपके साथ में सम्मिलित हो रहे हैं। जैसे कि आप सभी वैसे अनुभव करते हैं, हमेशा क्लास में भी आते रहते हैं, अभ्यास भी विशेष रूप से करते रहते हैं। रस रुचि इनकी काफी अच्छी है। यहाँ कल संघ के अंदर समाज में लोगों को हृदय के रोग के बारे में भी काफी कुछ समझाया और लोगों को सलाह सूचन भी किया। कोलेस्ट्रॉल क्यों बढ़ता है, हार्ट की बीमारियां कैसे बढ़ रही है, काफी कुछ बातें कल इन्होंने की अपनी तरफ से। तो लोगों को जानकारी बहुत आवश्यक है। आप लोगों को भी थोड़ा सा 2-5 मिनट।
कोई क्वेश्चन पूछना या क्या?
नहीं, योर एडवाइस टू ऑल।
सबको जय जिनेंद्र। तो जनरल एडवाइस, जैसे मरा साहब का बहुत इंटरेस्ट है प्रिवेंशन ऑफ हार्ट डिजीज, कंट्रोलिंग द रिस्क फैक्टर्स। हार्ट डिजीज का रिस्क फैक्टर्स क्या है? लाइक डायबिटीज, हाई ब्लड प्रेशर, हाई कोलेस्ट्रॉल, लैक ऑफ एक्सरसाइज, लोग एक्सरसाइज नहीं करते हैं, एंड अदर बैड हैबिट्स लाइक टोबैको। एंड वन इम्पॉर्टेंट फैक्टर इज स्ट्रेस। काफी लोग आजकल डिफरेंट एज ग्रुप में इतना स्ट्रेस लेते हैं, उसके कारण क्या होती है, उनकी स्ट्रेस ईटिंग एंड स्ट्रेस डिसऑर्डर वो साथ में जुड़ जाता है, उसके कारण हार्ट डिजीज का रिस्क ज्यादा हो जाता है। शॉकिंग इंफॉर्मेशन क्या है, आजकल हार्ट का प्रॉब्लम यंग एज में शुरू हो जाता है। आई सी लॉट ऑफ माय फ्रेंड्स टेलिंग मी फ्रॉम इंडिया that people have a heart problem at age of 30, 35 हार्ट अटैक में या आईसीयू में या सीसीयू कोरोनरी केयर यूनिट में एडमिट होते हैं। सो द मेन थिंग nowadays is you have to know your cholesterol level and work very hard in controlling the cholesterol. So one of the way we recommend is, cut down oil and ghee in your diet. Use very minimal because we don't need it in the body that much. Some of my friends use only 1 spoon of oil a whole week or whole month, actually. So that is number one. Number two, even if we eat food, try to do the exercise which will burn your calories. Or which exercise is good, whichever exercise आप regularly करेंगे वो exercise best है. Or 30 to 40 minutes brisk exercise for 3 to 5 times a week. It's very important, actually. So that will protect you from heart and the stroke. That's what the research says. So that's one. Second is control your blood pressure. A lot of people have a blood pressure issues. The top number is high. Sometimes the bottom number is also elevated. So the goal for the blood pressure is 130/80, 130/80. So look for that goal. You monitor your blood pressure. A lot of people monitoring the wrist. The best is to monitor in the arm and they keep your number. Sometimes a blood pressure in older people we allow a little bit higher, 140 or 150, but the goal is 130/80. The top number should be 130 and the bottom number will be 80. So that's one. And third, the next thing is diabetes. Diabetes is happening very commonly, very young age में हो जाती है diabetes आजकल. So one of the major factor for is diabetes, diet, and also lack of exercise. What we tell people is, a lot of young people obese, eating a lot of junk food and all those things. They develop something called the metabolic syndrome. Even though their pancreas is producing insulin, but that insulin does not work because they are kind of lazy. They are not doing enough exercise for insulin to work. So in those people, we recommend, try to burn out as much as possible with aggressive exercise The best exercise will be is where your heart rate can go higher, and you can relax back and let it go normal. Again, you can make it higher. So you have to do some kind of intense exercise. And nowadays, there is a lot of app available on the phone where you can monitor steps. Even my sister with me yesterday, she went for shopping and she came here. She got around close to 10,000 steps. So that is very important, actually. So you have to get as much as steps possible. Just being at home and doing in the kitchen work or sitting in the office or jewelry shop or a desk job, that's what we call, it is going to have a big problem. The reason is you're going to eat and keep on sitting on the desk, and you're not going to burn calories. The next thing I would like to mention is intermittent fasting. Intermittent fasting is very, very good. If possible, you can even do one upvas a week, or at least do not eat after, like Bhagavan Mahavir said, don't eat after sunset, and don't eat all the way till at least next to 12 to 14 hours. You give a break to the system. That is very helpful. That will have a less spike in the blood sugar in your body. So as much as possible, consider, and even in between meal, try not to eat anything actually. So that is also a good habit. And sometimes, in the breakfast and all, don't try to go for a heavy carbohydrate breakfast. Cut down your carbs. That's what we recommend people. The carbs are the white thing, rice, potatoes, and bread and all those things really increases the sugar very high. And then those are the carbs which doesn't digest properly, and then end up in having, more weight, more calories in the body. So that's why eat a healthy breakfast, and then lunch, and eat a good lunch. And then try to, in the dinner, try to cut down the dinner to a very healthy option. And then after a particular time in the night, try to avoid eating anything that will help you. So overall, I covered the risk factor, of course, stopping tobacco, who are using that. And then, so coming to the summary, to prevent your heart disease, the best option will be is to, my father, for example, he does a lot of walking, 1 hour, 1.5 hours, he walks in the morning. And I had a gentleman met yesterday in the temple downstairs. He showed me the phone. He gets around 12,000 to 14,000 steps every day. Morning 6 to 7:30, he is walking this thing. So he gets most of his steps done in the morning. So that is a good way. Morning ka exercise bahut acha hai, because whole day it will benefit you in burning the calories actually. So get your exercise done. There is no excuse. I am busy, or I work like this. I have to get up. I have to drop the children. I have to take care of this and that. Those are all excuses. So try to do early if possible. If you cannot do exercise in the morning, at least try to catch it up later in the day. So that's one. And second thing is diet, right? Diet, we have to be very careful what you eat. Avoid processed food. Processed food, ordering food from outside, those are really dangerous for the body. It's very bad. And especially people are nowadays addicted to the fast food like pizza, pasta, all those things. Best is always home cooked food. Use your ragi or jawar based this thing, and take a lot of sabji with that. And that will definitely give you enough nutrients, what you look for, so that this thing. And also I recommend drink a lot of water actually. So that is a common mistake. People are not doing it actually. So with this, I will summarize. With this, I'll stop. If you have any questions, you can ask, or I'll give it back to Marasa. Thank you.
Anybody, those who want to ask the question? Any type of the heart disease or cardiac or the cholesterol or any type of question, do you want to ask? The Dr. Sahib is here, so he is ready to give you the proper guidance. Well, Khushbu, what type of the obesity you see? Either the obesity is also cause for the heart risk or not?
Yes, actually, I have gained weight post my delivery, post pregnancy. So I am now starting to go to gym. So now certainly I've also heard cases where people get attacks in the gym itself. So how safe is it? Like, can we do mild cardio for that?
So you have to repeat your last 2 lines. I could not hear it. I know you mentioned that you gained some weight after the pregnancy. So what was your question?
I'll repeat my question. The thing is, post my delivery, postpartum, I have gained some weight. So now I am supposed to join gym, but I've also heard that in gym people get attacks and they,
Okay.
uh,
Yes, yes. So great question, ma'am. काफी बार मेरे पास भी वीडियो आती है, WhatsApp का वीडियो. Somebody is walking on the treadmill, dropped dead, or had a heart attack, right? You know, I would definitely recommend, you had the pregnancy. Otherwise, are you active before pregnancy, ma'am? Were you able to do everything what you want to do?
yes, but I have certain medical issues which I can then speak to you privately. I won't discuss.
Definitely. Some of them, Miss Ela Ben has my number. So before I recommend you exercise, going to the gym and doing aggressive exercise, I would like to know more information, not just you, anybody who asked me, can I go run in the gym? I said, then I have to look at any symptoms they have, any chest pain, any difficulty breathing, and are they active otherwise? What is the risk factor? Do they have diabetes or high blood pressure? Those things are family history, I ask. If they don't have, they were really active before, they were able to do everything, then we usually tell them you can go to the gym, but start gradual, don't do anything aggressive, and build up more and more from there. Most of the time, I'm assuming because you're young, because you just had a child, most of the time we recommend you can go ahead and do the exercise in the gym. But if you want to talk to me privately and let me know what your questions or risk factors, then I'm more than happy to talk to you and suggest you actually. And the common reason for weight gain after pregnancy, this doesn't happen in the most of the time. This doesn't happen with the local people, the white people there abroad, because our people, after pregnancy, they get fed with a lot of heavy calorie. Because even my wife had it. That's what I know, and she put on a lot of weight. Some of the weight she could not even lose now after 20 years. So those kind of unnecessary diet, because people say, "Oh, your mother, you're going to do this. You need all this thing." Eat normal diet after pregnancy. That's more than enough for you and the baby, actually. So I look forward to talk to you. Please reach out to me by my WhatsApp, and then we'll talk more. Thank you.
Sure. Thank you so much. Thank you, Mara sir.
हाँ डॉक्टर साहब मैं कलकत्ता से बोल रहा हूँ, मैं चरोरिया जी हूँ। मैंने अभी लिपिड प्रोफाइल का टेस्ट कराया था, तो आपका क्या ये व्हाट्सएप नंबर मुझे मिल जाए तो मैं आपको व्हाट्सएप पे भेज दूंगा, फिर मैं आपसे बात कर लूंगा।
Absolutely, yeah, definitely. नंबर आप किससे लेंगे? मैं यहाँ चैट में डाल दूं क्या?
हाँ चैट में डाल दीजिए तो मैं लिख लूंगा।
Okay, I'm doing it right now. While I wait for somebody else to give me the question, keep asking me while I'm entering the information.
या फिर मैं आपको मेरा नंबर बताता हूँ, आप मेरे को डायल कर दे तो।
I'm sending in the chat right now as we speak, sir.
लिख रहे।
One more small question I had. Now, considering protein, which is very negligible which is very less in Indian food, so is it recommended to have whey protein, at least half the spoon whey, or we can eat homemade?
Ma'am, yeah, that's a good question about the protein, right? I would like protein, right? Amount of protein intake, correct? Is that what you're asking?
No, I'm asking, I know the amount of protein actually. I wanted to do the whey powders that we get. Is it safe to intake or no?
No, you can take whey protein. I've taken it and I've recommended others too. But try to, I know it is easily said and done. Try to do the more protein from natural sources, like chana, some kind of Greek yogurt, rajma. From those sources, look for protein. If you want to supplemental, definitely you can do the whey protein. Actually, I like that putting in my shake sometime, and that is a filling actually. If you can skip a good breakfast and use a nice full protein with some fruits in it and blend it nicely, then that's a good option.
Okay.
But dry fruits is a good option actually for some source of protein actually.
All right. Thank you so much.
Thank you.
I think so. The whey protein, it is not good for health, you see, because it derives. What are the sources of that? So that today, some of the companies, then those who are making the different type of whey protein, it is not that much good, you see. and something which is coming from the animal product, you see, either the bone powder and so many other things which contains in that whey powder protein. So never to use these things. Better to use the nuts and the dry fruits and any other thing which contains the high percentages of protein. In proper Mumbai city and other places, you see, milk, cow milk or buffalo milk is also not that much good, you see, because artificial milk with having some chemicals and the detergent and other powders, it may harmful for all, you see. But if it is possible for you to make the milk in your house from the coconut, dry coconut and the ground nuts and the almond nuts and so many other things, so it will be give you the more high richness, rich protein. But if you will do some exercise, then it will digest. Otherwise, it is very difficult to digest. But very important thing to avoid all the bakery products and particularly dairy products. And then you can also be healthy, you see. If you will use the wheat flour and other things, it will be again increase your obesity, so many other things will be problem. So the Dr. Sahib is giving you the advice properly. So what is, again, the next question I am asking to the Dr. Sahib for you, all of you also. How to avoid the cholesterol, LDL, VLDL? First of the Dr. Sahib is giving you the information about the different types of the cholesterol.
So when आपने किसी ने कलकत्ता से भी बोले कि they will go to send me the lipid panel. जब cholesterol test करवाते हैं ना, there are 4 or 5 things they send you the report in the cholesterol test, and there is a even extensive cholesterol test. I'll come to that in 1 minute. The basic cholesterol test will have total cholesterol. That number is has to be below 200. Then comes the LDL. That's the worst cholesterol. That is the one which causes the blockage in the heart, called plaque formation. So the LDL, ideally the goal should be below 100. You won't believe it. Today I got a report from a 32-year-old, somebody's family member here. 32-year-old boy is having LDL cholesterol of 210, actually. That is super high. That will definitely lead to blockages in future. So anyway, total cholesterol, then LDL, then VLDL, usually we don't look at it. That is called very low density lipoprotein. Then we look at number called triglyceride. Triglyceride is also a cholesterol type, which is commonly elevated among a lot of Indian people, and which is due to a lot of sugar. So number one recommendation when we see triglycerides being higher, we recommend is cut down the sweets, carbohydrates, sugar, and then we recommend some weight loss. So that's number 4. So total cholesterol, LDL cholesterol, VLDL cholesterol, triglyceride, and the next one is the healthy cholesterol. It is called HDL. If you want to remember, H for healthy. So that should be above, actually should be above 30, like that. So how do you improve the healthy cholesterol? That's good for the body. That's one of the ways to improve is exercise, actually. So coming back to the cholesterol, why does the cholesterol build up in our body? So remember, we have an artery which supplies the blood throughout the body. The same artery supplies the blood to the heart, and there are some arteries which supplies the blood to the brain through the carotid arteries, and there are blood supply which goes to the stomach and intestine through the mesenteric artery, and there are blood supply to the legs with the different arteries. So what happens is when we eat food, especially with high in cholesterol, so that's a picture of the artery here. So what you see is that is the plaque formation, and then what happens is these are the cholesterol particle in the blood system. The food what we eat, it gets absorbed into the vessels and goes into the blood vessel, and these cholesterol particles run around throughout the body, and then slowly it forms a plaque, actually, like Marasab just drew. So that's the plaque here. So what happens is, so this plaque will get worse when people have, cholesterol high, and then high blood pressure, diabetes, lack of exercise, stress, overweight, tobacco, etc., etc. So what happens is these cholesterol particles are, you actually don't think if cholesterol, we say again, it's a silent killer like blood pressure. You won't have any symptoms. So it is like in your blood vessel going all over the body and keep on sticking. Wherever it wants to stick, it will keep on sticking. If it sticks in the heart, people will have a plaque and blockages. If the blockages get worse, they'll get chest pain, or if the blockage gets ruptured, and then there will be a clumping of the platelets, and then people can have a heart attack actually. Same thing can happen even in the brain arteries and stuff like that actually. So that's where the cholesterol bothers anybody by forming the plaque and blocking the artery, so that the blood supply to that place is really compromised. That's why people, when they walk and the blood supply is not enough through that artery, and they develop chest pain. That's why they say when we walk, we get chest pain. When I rest, I get better. So that's a common problem actually. So if you have a cholesterol high, they will be high in your blood and it is going to be sticking. The sad part is, when does it start sticking into the artery is from age 14. They have said that it will start sticking into the artery. You'll be very surprised. Sometimes I see the younger people's blood report and I see their cholesterol being very high. And then if you ask them, they're eating this pizza, pasta, all this bread-related item, burgers, bagel, and all those things. So those are the things we really need to look at it, and we give the healthy choice for ourselves and our family. Actually. Any other questions?
Yeah.
What's the difference between the pea protein and the whey protein? Because I think the Indian nutritionist, they say they recommended whey protein, but we get the pea protein here in States. So I was wondering. I know.
Yeah. Whey protein and the normal protein. Yeah. What is the difference?
I'm not a dietitian, so I have to look at it and I'll get back to you. I'm not very familiar with the other protein, what you're saying. I've seen whey protein. I've used whey protein before. But we can look at the contents inside and then decide.
Does it contains the animal protein, say the bone water?
No. The other one is the pea protein is plant-based.
Pea protein is plant-based. Green peas.
Yes, that is
green
good.
peas actually. Yes. See, the only thing is, end of the day, we look at the label, we read it. What is the protein content and where it is derived from? That's where I look at it. Most of the time, when I look at the protein powder or even the protein-related bars or chocolates, which my kids do quite a bit of that actually. I look at the protein content, how much a scoop gives you. That's where my protein knowledge is, but I can look at it and we can get back. I know where you are.
Thank you.
I have one question.
Yes, sir.
I'm 85 and I do exercise. I eat peanuts, almonds, walnuts for protein and soya milk. My LDL has gone up lately by 50%. And I was told by cardiologists that it's because of my age. So could age raise the LDL?
Not that I'm aware of that, LDL goes higher by age. Do you know when you said 50%, do you know what's your number?
I don't remember exact number, but say, for example, it has gone from 50 to 75, just 50% higher than what it used to be for many years. And I take Lipitor 20 milligrams forever. Okay. Now he wants to take a 40 milligrams.
So the interesting question is, I'm glad you're 85. You're doing very well at 85. Congratulations on that. Good work. Most of the time, we give them a statin or Lipitor, Rosua like that. But honestly, it is not studied in people at your age. Since you're active and healthy, we assume that you have a good longevity. So we do recommend controlling their cholesterols aggressively, and one of the ways is by giving the medication actually. I don't think your cholesterol went from 50% to 75% or whatever raise what you mentioned is just based on age. Probably diet related, probably I would say if jump is significant without any changes significantly in your routine, diet or medications, then I would say when you repeat it, you look at it and see if it's not a lab error actually. So I would
Okay.
ask you, was it a fasting cholesterol, sir?
Yeah, it was a fasting no, it wasn't fasting cholesterol. No, it was not.
It was not, right? So it's very hard actually. Was it the thing what you're comparing from now and before? Was it a fasting before?
Yes,
Okay.
fasting before, but this time it was.
Yeah. So you have to really compare from fasting to fasting, and non-fasting. I would not worry about cholesterol jumping to that number actually. So when you do next time, I would recommend going to do the fasting. And in regards to Lipitor, did you increase the dose already from 20 to 40?
Yes, I have done that. Yes.
So you're tolerating it, right?
Yeah, it's very tiring. I feel very tired when I take it, but I was told to take it at night time, and that's all I can do, But it is tiring, yes. And otherwise,
You felt more than before, is it? Tiring?
With 20 milligrams, I wasn't tired, but
Statin is a notorious drug for that. And if you really, I'm not trying to add more medicine. Excuse me. If you really want to counteract the tiredness or fatigue from statin, then we recommend a couple of things. Just make sure you check your vitamin D level. Yes. D for David. Usually, if it is vitamin D low, then people develop more statin-related side effects. Or sometimes we recommend there is a vitamin called CoQ10. Have you heard about it, sir?
Yeah, but it is not vegetarian.
You know what? Good question. I am not sure about that part actually.
I take vitamin B3 forever, and I take vitamin B12 forever.
Yes,
so
sir.
Those I take, but I don't take CoQ10. I was told many times to take that, but I think I could be wrong. I think it's not vegetarian. That's why I don't take it.
Yeah, most of my vitamin shopping is usually from a vegan source, but I look at it actually. I won't tell you whether it is available as vegan or not. Actually.
Okay, I will look into that if I can find from India. Okay. Thanks.
Thank you.
Can I ask a question, Doctor? Pranam.
Please, pranam, ma'am.
गुजराती में बोली सको?
मैडम मेरे को हिंदी आती है, गुजराती नहीं आती है.
नहीं हिंदी बोलिए.
हाँ, मारा सर एक्चुअली છે ને મારા સાસુ ને છે ને એન્જિયોગ્રાફી સ્ટેન્ટ બેસાડ્યા છે 2, પણ હવે એના તળિયામાં છે ને એને બહુ સોજા આવી જાય છે. ડોક્ટર, is it related to the heart? And she loses balance. She doesn't have a grip on the feet.
Angiography is done and 2 states. Yes. And still she is getting edema in the legs.
Swelling in the legs, right?
Yes.
Yeah, swelling in the legs.
Swelling in the legs is a very common problem actually. A lot of times it is related to salt. If you're taking too much salt, it will hold fluid in the body. The common place to hold the fluid is leg. And after that, it keeps on going belly sometimes it go into the lungs. The other thing is, stent placement does not usually cause swelling. The swelling is usually caused by how good is your heart pumping. So we call that, a lot of times people who have a blockage have a weak heart muscle, heart may not pump. So we look at a number called ejection fraction. So if ejection fraction is normal, that's a good news. But people can still have muscle stiffness as people get older or due to high blood pressure. The heart muscle can get stiffer. It won't relax properly. We call that as diastolic dysfunction. Sometimes what happens is the heart won't relax properly, and then when they take excess fluid, it will develop swelling and a shortness of breath, etc. So there are 2 types of this thing. So the best option is I would know what is his pumping function or ejection fraction, and then make sure the blood pressure is very good, and then salt intake has to be reduced actually. And then does he have any difficulty breathing?
Not of now. She doesn't have that. Yeah.
So you mentioned swelling. Did he gain any weight?
No, the weight is also constant, but only her thyroid she has, and the weight is 75 kgs.
He or she? This is
she. My mother-in-law.
Mother-in-law. Okay.
Yeah.
What is age?
Age is 79.
79. Okay. So the other option is, does she, I'm sure probably she has blood pressure problem, right?
Because in the actually, yeah, must be because there's so many ecosprin, so many tablets she's taking. I don't know which is for blood
No,
pressure.
ecosprin is for the stents actually. So she must be on the blood pressure. All you have to tell is
Symptoms of the blood.
blood. All you have to mention to your doctor, general practitioner or cardiologist is adjust the medicine. Usually, when people have a swelling, we adjust the blood pressure medicine to a diuretic. Actually, diuretic means we call fluid pill where people will pee out a lot of urine. Actually, when you do that, blood pressure is also controlled and the swelling is also better. Actually,
Okay.
talk to your general practitioner cardiologist to see if they can switch it to a different this thing agent. Actually.
Okay. Thank you, doctor. Thanks a lot. Pranam Guruji. Mathena Vandan.
जय जिनेंद्र.
एक सलाह એવી છે કે यदि अंदर चंद्रप्रभा वटी लो, चंद्रप्रभा वटी is the name of the medicine which is already made by the Divya Patanjali, and it may use for that. If the urinary problem, you see any type of urination problem, then again the swelling in the legs are also coming. So if the frequency of the urine will be increased with the help of the Chandra Prabha Vati. Again, second thing, to reduce the salt, consuming the salt, you see, anyhow. Third thing, to stop totally the Tata salt, you see.
Okay.
Never to take,
સિંધાલ નમક ચાલે ને ગુરુજી? મારા સાહેબ સિંધાલ નમક?
हाँ जी, हाँ बोल.
सिंधाल नमक चलते हैं क्या?
Senda namak, but reduce the percentage, the quantity of that. Not to take more amount of that, because the age is also considered 79, weight is also 75. And if the protein will be absorbed in the body and the salt will be stored in the body, then it will take the water flow more than that. Then the swelling will come regularly. So anyhow, to increase the frequency level of the urination, that is important. And to reduce the, or to stop totally for the salt, you see, for 1 week only.
અચ્છા, 1 week.
અચ્છા, તમે ક્યાં રહો છો?
હું મસ્કત રહું છું મારા સાહેબ. એટલે પતંજલિની આ ચંદ્રબાબા વટી કેટલો વખત દિવસમાં લેવું?
2 વખત, સવાર સાંજ 2 ગોળી લો.
અચ્છા.
હા, અને હું કેવી રીતે મોકલાવું તમને? અહીંયા છે અર્જુન છાલનું પાવડર છે, એટલે બહુ જલ્દી તરત ફાયદો આપે એવું અર્જુન છાલ છે, અને એની અંદર તજનો પાવડર મિક્સ કરેલો છે. એટલે કોઈ હોય તો કોઈ થી મોકલાવી દેવાય.
ત્યાં તો કોઈ નથી મારા સાહેબ. મારે શું કરું?
ત્યાં મળે?
અંધેરી છે ને મારા સાહેબ? અંધેરી છો ને તમે?
હા, પણ ત્યાં તમને મસ્કતમાં અવેલેબલ હોય તો વધારે સારું. હવે
મસ્કતમાં મળી જશે.
ઠીક છે, ઠીક છે, વેરી ગુડ.
હા, થેન્ક યુ મારા સાહેબ.
For the general knowledge, you see, for all of the person, this is the particular name of the tree which is called as a Arjun. The name of the tree is Arjun, you see. But the trunk and the skin on the trunk, you see, when it comes down, you see, naturally, or the person can take from that trunk also. Then make the powder of this. And then the taj, dalchini, mix with that. If you are taking 100 gram of the Arjun chal powder, you see, then mix up with the 30-40%, 30 gram or 40% of the dalchini powder, mix up with that. It's the best general heart tonic. And the 3 works it is functioning that it will reduce your blood pressure level, it will circulate the blood in the heart and the whole body fast, and then again to support the heart also. So the person, the very first of all, how to reduce the cholesterol level and change in your diet system. If it is possible to stop the wheat and the wheat flour powder and any other thing, why not to use that, the jawari, bajri and makka? You see, Dr. Sahib is also saying that it is best. And those who are taking only the white rice, you see, some of the people are having habit of the basmati rice, you see, that is also very bad for this. So why not to use that today's millet, you see? So the person, those who are using any type of millets, they will not get that type of problem. So some of the person having overweight and obesity and other thing, you see, anyhow to stop the wheat totally and the rice totally, and the substitute for that, the millets, if you will use, it will be more better. Or the jawari, badri and makkah is also better for that. And to take the fruits and the vegetables, that is also again good. So anyhow to reduce the LDL, you see, what is happening today, you see, there are the different types of the oils are coming in the market, and all are the refined oils, you see. The refined oils also, the two types, double refined, triple refined, different types of the oils are also coming. To avoid that particularly, and if you will get the proper kachi ghani cold process oil, you see, it is not increasing the cholesterol level. But today's the particular type of ghee, it is not the natural original ghee. If you will get the proper ghee, in the sense it is from the Gir cow's ghee, and which is made of our Indian Deshi system, you see, it will never increase the cholesterol. Even that, especially the kachi ghani oil of the cold process, it will never increase the cholesterol level. It is already proven that, and having the laboratory proofs also. But the person, those who are using any type of oil which is available in the market and in the high percentage, doctors have said that their client, you see, using only the 1 teaspoon oil only in 1 week or 1 month. But in India, some of the people, those who are using 2 or 3 teaspoon oil every day, then what will happen, you see? So anyhow, to reduce the totally oil, you see, the zero oil cooking system, already it is developed by Dr. Bimal Chajer, you see. He recommends especially for this also. There are so many other things. So anything which is made from the bakery products and the dairy product, if you will stop these two things, and if you will use the fruits, vegetables and dry fruits and other thing, you will reduce immediately, the result is coming. Bolo, Khushbu Ben, પૂછવું છે?
One small quick question. I wanted to know how dangerous is the visceral fat for the heart? The visceral fat.
So that's a very good question. Lately, we know people who have a fat in the belly, we call that visceral fat or abdominal obesity. That has a good correlation for developing something called, I mentioned a little bit, called metabolic syndrome, where they have their insulin doesn't work as good as normal people's insulin, and there is a very good correlation for having excess visceral fat leading to cardiac disease. Actually, cardiac disease, especially the blockages of the heart. Actually, and people who don't have it, usually they are really super active or healthy, and their chances of having blockage in the arteries or elsewhere is less. So when we look at people, there's a lot of people have this metabolic syndrome where their waistline is really bigger, mostly from the adipose tissue or visceral fat. Actually.
Thank you so much, Doctor.
Anybody else? Those who want to ask the question?
મારા સાહેબ આ અર્જુન ચાલ ને કેટલો લેવાનું રોજ સવાર રાત?
One teaspoon in the morning and 1 teaspoon in the evening. You can make the ukali. Ubali, you see, in the 2 glass water, you can use the 1 teaspoon of this and boil it and then burn the half portion of that and use early in the morning and empty stomach. Again at the 4 o'clock in the evening also. If you will regularly use this thing and stop the salt also, and so many other things had changed the total food style and the lifestyle, then immediately you can get the result within 1 or 2 months also. There are so many other treatment in to reduce the cholesterol level. दूधी जने आपने कहिए छे लौकी जिसको बोलते हैं, just to remove the skin of that lौकी, small size, within 7-8 inch only. Then cut the pieces and make in the mixer, you say, and use some half glass water. Then you will take this for a long time, 2, 3, 6 months, you say, cholesterol will reduce immediately. Another thing is ashgard, you say. The people know very well that ashgard juice also. So just to remove the skin of the ashgard, make the pieces of that and in the mixer, you can just use on half glass of the water, just without using any salt or anything. If it is possible to use the 2 or 3 black pepper in that, it will be create more lot of benefit, you see. So early in the morning or in the mealtime in the afternoon, if you will take 1 glass or half an hour glass, you see, it will be reduce the cholesterol level immediately, and it is giving you the good benefit also.
મારે એક સવાલ પૂછવો છે કે બે વસ્તુ, એક તો દૂધીની જગ્યાએ અમેરિકામાં અમે લોકો ઘણીવાર ઝુકીની વાપરીએ છીએ, which is the same family. Sunilbhai, do you know about that?
Zucchini?
हाँ.
Zucchini, yes, it's a very good one actually. मगर दूधी मिलती ना सर वहाँ, we get it, no?
No, I mean Ohio and दूधी મળે છે પણ very expensive. Zucchini is much less expensive. So normally from American stores we just buy zucchini, you know.
So zucchini is also very good for the health actually.
But if you are not getting zucchini is not available or dudhi is not available, then ashgard is also with the same result also.
Okay, that's a good one.
Ashgard, if the ashgard is available there or not, you see, just find out that, then the same result will come.
Okay. એસ્કાર્ડ એટલે શું મને ખબર નથી.
આપણે જેમાંથી આગ્રાના પેઠા બને છે સફેદ કોળું.
Okay, I got it. Yeah, okay.
સફેદ white કોળું જેને કહેવામાં આવે છે. There are the two types of the કોળું. One is the yellow color and another is the white color. So white color, that ashgard you see. Pumpkins, you can use the pumpkins is the yellow color. So the people, those who are making the agra petha, because they are making the pieces of that and just putting in the sugar water, so it will be sweet like this. But don't make this, because sugar is also very harmful. Khushbu Ben, agar aap jo hai, if you can totally avoid the sugar, then your obesity will come down immediately. But sugar is also sugar, salt, and another third thing is the baking powder, that the 3 white poisons. Anyhow, we should avoid it from our kitchen. And 4th one is the oil and 5th one is the ghee. And the butter also, it is cause for the high cholesterol, you see. So if it is possible to reduce that, and if it is possible for you, you can get the ghee, cow's ghee, you see, which is made by the Deshi Indian process. That is totally different thing. So if it is possible, you will use it 1 teaspoon or the 2 teaspoon, it will never increase any type of LD or VLDL, you say. It is proven here also.
એક સ્ટેટમેન્ટ છે કે મેં સાંભળ્યું છે કે because of my age, the metabolism slows down, and that because of the age, you know, and that causes fat around the stomach. Am I correct?
Yes, metabolism definitely goes down after we get older. At the same time, you know, for some people, the quantity of eating is also goes down actually. So they maintain a weight. And some people, they develop more deposit of the fat as they get older actually. So that also happens actually. So one of the main reason is metabolism. The other thing is, you know, they don't burn out because of the poor metabolism. And also, they were not as active as before, actually. So that could be another reason in the imbalance and causing the fatty deposit.
So what is
See, that my advice is this, that you are having the age of 85 and the physical function is very less, you see. Now, if you will eat anything without the wheat and without the wheat flour and the rice, you see, then you can increase your metabolic system. To use for that 2 or 3 black peppers every day in the morning and 2 or 3 black peppers in evening meal also. Again, the 1 teaspoon in the morning ajwain. We are saying apne Gujarati ma ajmo kahiye, or in the morning and afternoon you say. Then the metabolic system will also increase, your digestion will increase, gastric problem will not increase, you see. This is good for health also. Because what we say according to the Ayurveda Shastra in the body, if the gases will increase, then it comes to the heart attack. It may cause for the heart attack. I think so. One of the Dr. Bimal Chajad and other people, they says that in the 40%, 50%, it is not the really heart attack, but it is the gastric problem. So when the gases are over increasing, then what will happen? So this is the problem. Now you will see that this is the special ghee, which is only called as the Gir cow's ghee. The Gir cow's ghee, you see, its colors is also yellow color, because the Gir cow, which is having only the yellow color skin in the whole body. So that is special cow, you say. But today the people, those who are getting the ghee from the Jersey cow, which is already hybrid, you see, crossbreed. So that is very harmful. And as a common the ghee in the market, which is available of 500, 700 or 1,000 rupees, because which contains the big fat in also. And it is in the hydrogenated process. But this type of ghee, it is in the homemade, by the homemade process, you see. Nothing, no machine vagere use it. So the cow's milk, they just boil it, then convert in the curd form, then make it in the handy process. In the hand process, they make the makhan, then immediately they burn out that and convert as a ghee. So this type of ghee, if you will put in your house for a year or long time, 2 years also, it will be not bad, you see. But this is very costly thing. It is available or not available everywhere, I am not knowing that. But this is here. So I am showing you that this is very good thing for us. It is not increased. Now the doctors have mentioned about the HDL, H for healthy, you see, because our body requires that type of cholesterol in the body. Each and every person, we have that type of fat and cholesterol in our body, but it is healthy. So healthy thing from wherever you get, you see, what are the sources of that? This is also available in Ayurveda. I am talking about the Ayurvedic angle, you see. Our in Mahavir Swami had mentioned this, that there Nayavada and the Syadvada. So what is the meaning of Nayavada? According to Nayavada, which thing is correct from which angle? Not good for all person, but there are the good things. No, if we eat, because the body requires that. So many types of the gastric problem, the acidic problem, because our level of that blood, you see, it is not alkaline. More or more person, you see, 80% people having the acidic problem, because they are just taking the tea and coffee and so many other things and chili things. It creates, increase the high level of the acidic condition also. So due to that acidic condition, the gases will become over, you see. It is also cause for the heart disease and heart attack also.
મારે એક વસ્તુ રિપીટ કરવી છે. મારા સાહેબ, તમે કીધું અજમો લેવાનો અને બ્લેક પેપર લેવાનો.
Right.
બ્લેક પેપર સવાર સાંજ 2 કે 3 ગોળી લેવાની.
2 થી 3 બ્લેક પેપર જે તમે જમતા હો, ખાતા હો, એના ભેગા ચાવીને ખાઈ લેવા.
ઓકે. અને અજમો કેવી રીતે લેવાનો? સવાર સાંજ
1 ચમચી અજમો સવાર સાંજ ચાવવાનો.
ઓકે ઓકે. ખાલી સવારે જ, સાંજે લેવાની જરૂર નથી ફરી?
સાંજે પણ લેવાય.
ઓકે ઓકે. કોઈ નુકસાન નથી એમાં અહીંયા.
नहीं नहीं फायदो ज छे काका.
ઓકે, થેન્ક યુ સર, થેન્ક યુ સર. મારે સર
સાહેબજી મસ્કતમાં છે ને 50 ડિગ્રી ગરમી છે તો ચાલશે અજમો ખાઈએ તો 1 ટીસ્પૂન?
આ તમારે અજમો ઘીની સાથે ખાવાનો અથવા અજમો ચાવ્યા પછી ગોળનું પાણી પીવાનું. જાગરી
અચ્છા.
વોટર યુ સે.
અચ્છા, થેન્ક યુ મેમ.
Aji, anybody else more? Do you want to give any other advice? General knowledge about?
I mentioned everything.
Okay. Understand. The time is over now. Shall we start the second class? Namo Namo Orientanam, Namo Siddhanam, Namo Vajjayanam, Namo Lo Esabbasagunam, Esopancha Namokaram, Sabba Papa Panasam, Mangalanam Jasabbesim Padamam Havai Mangalam. Mangalam Bhagavan Vero, Mangalam Gautama Prabhu, Mangalam Stulibhadradya Jaina Dharmostu Mangalam. Chattari Mangalam, Arihanta Mangalam, Siddha Mangalam, Sahu Mangalam, Kevali Pannato Dhammo Mangalam. Chattari Loguttama, Arihanta Loguttama, Siddha Loguttama, Sahu Loguttama, Kevali Pannato Dhammo Mangalam. Chattari Saranam Pavajjami, Arihante Saranam Pavajjami, Siddhe Saranam Pavajjami, Sahu Saranam Pavajjami, Kevali Pannatam Dhammam Saranam Pavajjami, Sarva Mangala Mangalyam, Sarva Kalyana Karanam, Pradhanam Sarva Dharmana, Jainam Jaya